Hi everyone, and in this video I'll be discussing the drug for constipation. So constipation is one of the common problem when the patient comes to the doctor. And what is the problem in constipation? The problem is the patient has difficulty in passing stool. Now basically why the constipation occurs, there are two reasons for constipation what we can come across. One is the organic cause. One is the organic cause. So in organic cause, patient will have some problem, for example, some obstruction in the intestine or because of some tumor in the intestine. So in that cases, the drugs will not work. So better to treat the cause. So better to treat the cause for that constipation. So that is one thing you can do. Another type of constipation, what we see is the functional constipation. So functional constipation is a problem where it is not because of some obstruction, it is because of lack of fiber in the diet. So patient doesn't take fiber in the diet and that's why he has difficulty in passing. Second important cause is lack of exercise. So nowadays you know that there is sedentary lifestyle, and also another important is the sedentary lifestyle. So these are the things, and also nowadays there is abnormal bowel habits. So some days they will pass it at 10 o'clock, some day at 7 o'clock. So that abnormal bowel habit also contribute for functional constipation. To whatever constipation we use drugs, except organic we have to treat the cause, but functional constipation, other things we use drugs. So the drugs for constipation, basically we need to understand two terminologies. One is called the laxatives and one is called purgatives. So they are the drugs used for treating constipation. But what is the meaning of a laxatives? Laxatives also evacuate the stool. So here they evacuate the formed stool. That means the stools will have a shape. But a purgative will cause more action and that will evacuate watery stools. It is like a diarrhea, so it will cause like that. So we use laxatives and purgatives for managing constipation. Now let me take one more slide and explain to you where to use this laxatives or purgatives. Uses. Number one, as I talk in the beginning, functional constipation. For functional constipation, you have to educate a patient to use fiber diet, to do exercise, and to regularize the bowel habits. Second, we do it before surgery. Now, before surgery or before endoscopy, we have to evacuate the bowel, then we use these drugs. Number three, we want to decrease the straining so that will not affect certain things called hernia. So to decrease the strain, because constipated patient, they have to put more strain to evacuate the bowel. So which condition you want to decrease the strain? One is if the patient is having hernia. Suppose the patient is having cardiac diseases. So where we don't want him to strain much, cardiac patient. Number four, certain poisonings, we want to induce diarrhea and remove the poison. Number five, in case of deworming, we are inducing this purgation. So these are the uses of laxatives and purgatives. So what are the drugs in this category? We will go one by one. Number one, we have drugs and they are called bulk forming laxatives. So these drugs are called as bulk forming laxatives. What is the name of the drug? They are bran, then ispagula, then we have methyl cellulose, and psyllium. So these are nothing but these are not digested by our intestine. These are indigestible substances. These are indigestible substances. Now, what is their mechanism of action? How do they work? Let me write here. So the mechanism of action is like this. Suppose, let me write the intestine. What happens here? So this is the intestine. So whenever a person ingests this bran psyllium, these are indigestible and these are hydrophilic in nature. So since they are hydrophilic, what the drugs will do, the drug will attract water. So when the water enters into the stool, so the water start entering into the stool, what happens? The stool will swell up. So the bulk of the stool increases. Bulk of stool increases. Now when the bulk of the stool increases, what happens? It will stretch. It will put a stretch on the colon. So when you put a stretch on the colon, what happens? There is increase in peristalsis. There is increase in peristalsis, and that will evacuate the stool. So since they are increasing the bulk of the stool by attracting more water, they are called bulk forming. The question asked is, will they work immediately? No. So they will take 1 to 3 days to start working. So they don't work immediately. So since they stretch the intestine, what is the adverse effect we see? The adverse effect we see is, one is the flatus, and the patient will complain of abdominal pain. Now, where you should not stretch the intestine, it is contraindicated if the patient is having megacolon. So this is how the bulk forming laxatives work, and this is their mechanism of action. And I have told you they are slower acting. That is the first drugs. The second group of drugs, what we are going to discuss now, they are called as the stool softener. The name itself is telling you they will soften the stool. How do they do that? These drugs will either add fluid or oil into the stool. So by doing that, they will soften the stool, and by softening the stool, it is easier for the stool to move out of the intestine. So what are the example of drugs which come across this? They are called docosids. And one more is a mineral oil, and that is called liquid paraffin. Liquid paraffin. So these are stool softener, but liquid paraffin is a favorite for examiner. So let me write that for you. Liquid paraffin. So it is basically a mineral oil. So liquid paraffin basically is a mineral oil. So the oil will enter the stool, soften it, and it is easier to move out. But when we administer the liquid paraffin, there are adverse effects. So what are those? Number one, this mineral oil is ingested by the macrophages. Macrophages in the intestine, they ingest it. So that can lead to foreign body granuloma. So patient may have foreign body granuloma. Second, it's a mineral oil. Suppose when the patient takes it at the night time, the oil can trickle down from the stomach to the esophagus, then to the lungs. So this will lead to lipid pneumonia. So there is a chance of lipid pneumonia. So usually avoid at bedtime. So better to avoid this drug at bedtime. Another important complication is it decreases the fat soluble vitamins. What is this? The vitamin A, D, E and K. These absorption are interfered and the patient will have deficiency of this. Sometimes what happens, the soiling of the cloth will occur because patient will unknowingly will have purgation. So that's a embarrassing situation for the patient. So the name is liquid paraffin. It's a mineral oil. Most importantly, they have asked what vitamin deficiency does it cause? It decreases vitamin A, D, E and K. So I told you soiling means insensible loss of the oil in this thing, rectum. So patient will not know, suddenly it will be wetting the underwear. So that is a problem what the patient will face with that. So these are the stool softener. Moving on to the third important drugs, they are called the stimulant or the irritant purgatives. So if you read the name itself is telling you either they stimulate or irritate the intestine. The mechanism of action is they will irritate the intestinal mucosa. So you know that when the intestinal mucosa is irritated, what happens? There is increase in peristalsis, and that will evacuate watery stools. So watery stools are evacuated, that's why they are called purgatives. Right, that is the mechanism of action. But what are the drugs in this? Number one, we have a drug by the name bisacodyl. The name is called bisacodyl. The bisacodyl can be given in two routes. Either you can give oral or you can give it rectally. When you have to give it orally, the drug will not work immediately. You have to give it in the night time. So it takes 8 hours to start working. So suppose you want to treat constipation, you have to give in the night, morning you can evacuate. But when you give it rectally, the drug starts working within 1 hour. So the 8 hours or 1 hour is the onset of action of this drug. So depending on what is the situation, you can use the drug either rectally or orally. Now another drug which are called as stimulant or irritant purgatives, they are called anthraquinones. They are called as anthraquinones. So the name is Senna. The name is Senna, and one more drug is Cascara sagrada. So these are anthraquinones. But one major adverse effect, what they will do is they cause a pigmentation of the colon, and that is called melanosis coli. So they can give an image of pigmentation of colon, and then they can ask you what purgatives or laxatives can cause this, Senna and Cascara sagrada. So we have discussed 3 important purgatives and laxatives. The last one is the osmotic laxatives. So the name itself is telling you, because of the virtue of osmosis, they will retain the water inside the bowel, and that's how they remove the stool, and that is form stool. The osmotic laxatives are lactulose, and one more drug is lactitol. Now this lactulose and lactitol, apart from constipation, they are used for one more condition. They are used in a condition called hepatic encephalopathy. They are used in hepatic encephalopathy. You may ask a question, out of all the drugs used for constipation, why only lactulose and lactitol are used in hepatic encephalopathy? To understand that, let me take a slide here. This is the gut. This is the intestine. Okay. Now what is hepatic encephalopathy? Hepatic encephalopathy problem is the ammonia is very much high in the circulation, and that ammonia has entered the brain. So this is the brain, and the ammonia is causing hepatic encephalopathy. Now what happens is, in the gut there are bacteria, and these bacteria are going to generate ammonia. So this ammonia can get reabsorbed back and it will worsen the hepatic encephalopathy because already the ammonia levels are very high. Now what is the strategy? The strategy is to kill the bacteria. So the bacteria can be killed by the drugs such as rifaximin, or it can be done by using an antibiotic called neomycin. They can be used to kill the bacteria. Or one more strategy what can be done is by using lactulose or lactitol. Now what happens when we use them? When they enter the gut, they are broken down into lactic acid, and the lactic acid makes the environment acidic. The pH of the environment becomes acidic. Now I want a basic understanding of general pharmacology here. Now ammonia is generally a basic one, right? You know that if you place a basic substance in acidic medium, what happens? If you place a basic drug in acidic medium, what happens to the ammonia? Will it be ionized or non-ionized? Think and tell me. So here it will be ionized. So if it is ionized, it is not absorbed. If it is not absorbed, ammonia level will not increase. It will not worsen the hepatic encephalopathy. So the reason why only lactulose or lactitol is used is they are converted to lactic acid and they make the environment acidic. In the acidic environment, ammonia being basic will become ionized and not absorbed. That is the reason why it is used. So that is one of the commonly asked questions in your exams. Apart from that, the osmotic laxatives are polyethylene glycol. So in short, it is called as PEG. Now polyethylene glycol is usually given before surgery to clear the bowel, and also it is given before endoscopic procedures. So these are the osmotic laxatives. So until now I have discussed 4 important drugs for constipation. They are laxatives and purgatives. Number 1, the bulk forming laxatives. They take time, they increase the bulk of the stool, contraindicated in megacolon. Number 2, what I discussed is the stool softener, but liquid paraffin. Remember the adverse effect, foreign body granuloma, then lipid pneumonia, loss of fat soluble vitamin. Then we have stimulant or irritant. Remember senna, cascara sagrada. The adverse effect is melanosis coli. Osmotic laxatives are lactulose and lactitol. They are used in hepatic encephalopathy. I told you the mechanism. PEG, polyethylene glycol, is used for surgery, before surgery and before endoscopic procedure. So these are the drugs mainly used for constipation. Certain times we also come across constipation that is because of drugs. So there is something called opioid induced constipation. Opioid induced constipation. So when a drug, opiates, which patient will take opioid for very long time? Either he should be addict or patient is taking for cancer therapy. So opioid induced constipation, the drugs what we use is methyl naltrexone. Then we have naldemedin. Then we have naloxegol. And we use a combination of naloxone plus oxycodone. So naloxone, oxycodone in the ratio of 1:2. So these are the treatment for opioid induced constipation. So what are these? These are all opioid antagonists. So they block the opioid effect on the gut and they prevent the constipation. Another drug which is an opioid antagonist, the name is called albumopan. So albumopan is an opioid antagonist. So it is used for post-operative bowel recovery. For post-operative bowel recovery, this is used, but there is a warning for this drug. So black box warning that it increases cardiovascular deaths. So it is to be used only for 15 doses. So 15 doses are the doses approved for uses. It's not approved for more than 15 doses. So the name is called albumin. Okay. So these are the opioid-induced constipation drugs, and one more opioid antagonist is albumin. Okay. So here we have methyl naltrexone, nalmefene, naloxegol, naloxone. Now, why do we use the combination is a question most of you ask. Now, naloxone is not absorbed from oral. So it acts locally when we give it oral. Oxycodone is absorbed and it will go into the brain and decreases the pain. So if a cancer patient is taking these drugs, I told you they can suffer constipation. But I don't want the drug to stop working in the brain. So oxycodone gets absorbed and decrease the pain. But oxycodone, if it acts in the periphery, it can cause constipation in the gut. So how do I avoid it? I use naloxone. So naloxone acts locally and prevent the effect of oxycodone on the gut and prevents the constipation. That's the reason we use the combination here. So one is we will not get the opioid-induced constipation. Second, we will have the decreased pain for the cancer patient. That's why the combination is used. So one more constipation issue what is commonly asked is the irritable bowel syndrome. So irritable bowel syndrome, there is predominance, that is called constipation predominant cases. So in that we use laxatives, what we discussed currently, they can be used. Second, we can use a drug called linaclotide. So linaclotide, one more drug by the name plecanatide. These drugs stimulate an enzyme called guanyl cyclase, and that will increase cyclic GMP. And that cyclic GMP will increase chloride secretion, and that chloride will draw water. So that is helpful in managing constipation. Similarly, we have a drug by the name lubiprostone. So lubiprostone will also activate the prostaglandins and increases the chloride, and that will increase the water. So obviously when the water content increases in the stool, it will easily go out. And the last one is prucalopride. So prucalopride is a 5-HT4 agonist. So prucalopride is a prokinetic agent. It increases the intestinal motility. So you can remember by the mnemonic L, L, L and a P. So L for laxatives, linaclotide, lubiprostone, and P for plecanatide and prucalopride. These are very smaller topic, but still the mechanisms are asked. So that's why it is being dealt here. So with that, I will end up this video, the drugs for constipation. I hope you understood what is laxative, purgative, and what are the important points in this. Thank you all.